Speed now on the coronavirus. It is going to be a big week with Texas and other states across the country trying to reopen. New polling shows most Americans are concerned that states will reopen too quickly. Now here in Texas, health officials think we're at or past our peak for COVID-19 cases, but the virus has taken a toll. Nearly 19,000 people have confirmed cases, with many other untested cases likely. Harris County leads the state in confirmed cases with close to 4,600, and the state death toll is now 477.
Today, Texas will gradually reopening following Governor Greg Abbott's announcement. Janelle Fort has what you can expect later on this week.
Xavier, the first part of Governor Greg Abbott's plan rolls out today, and depending on how it goes, April 27th, the governor says he'll announce additional sectors of the Texas economy that may reopen with restrictions. Starting this morning, Texas state parks will reopen. Visitors will have to cover their faces, practice social distancing, and limit groups to 5 or fewer people. Then Wednesday, some non-emergency medical procedures will be allowed to resume. And on Friday, retail stores can offer to-go style services for customers. But many people are wondering, is Houston ready? Medical experts say we have yet to reach our peak and warn that reopening too soon could have grim consequences.
If we take our foot off the brake, we can easily start moving back in the other direction.
Local officials say the Houston area should only start to reopen once the full scope of the virus can be measured. Locally, we fell further behind on testing this weekend after severe weather forced several public drive-through testing sites to close. The stay-at-home order remains in effect in Harris County. A similar order was revoked for Montgomery County residents on Friday. Back to you.
Okay, Janelle, thank you. According to new data, Houston is not ready to reopen. The latest models showed Texas peaking yesterday. The Institute for Health Metrics and Evaluation shows a big drop in projected deaths. Dr. Peter Hotez from the Baylor College of Medicine credits the drop to social distancing. As Governor Abbott prepares to reopen the state, Dr. Hotez says it's important to slow down.
There are a lot of people walking around the city of Houston who have no symptoms and are transmitting the virus, and you don't know who has it and who doesn't, and for that reason you need to maintain social distancing at least for a while longer.
Dr. Hotez says Houston's testing capabilities are still far from where they need to be to reopen. We're told there are more localized models for major cities, including one for Houston.
The call for more coronavirus testing, protesters demand to reopen the country, and a new small relief package for small businesses. Your Rush Block continues. President Trump says so far, America's tested more than 4 million people.
America continues to make steady progress in our war against the virus. As of today, we've tested 4.18 million Americans.
The president now pushing to keep raising that number. He says he'll use the Defense Production Act to force companies to produce more tests. Today, the state of New York begins surveying 3,000 people for coronavirus antibodies. Governor Andrew Cuomo wants to find out who may be immune to the coronavirus. It's seen as a key to getting the state back to work. Thousands of Americans defied stay-at-home orders in protest. From Salt Lake City to Seattle to Denver, they blocked traffic and streets demanding governments reopen now. This comes after the president's tweets last week calling to liberate Michigan, Minnesota, and Virginia. More money on the way for small businesses and hospitals. Today, a new $450 billion stimulus plan could go before the Senate. Congress and the White House hope the deal will pass by this Wednesday. On the road to recovery, HPD Detective Ray Cervantes opened his eyes after 3 weeks in the hospital with COVID-19. Chief Art Acevedo tweeted the good news on Saturday, saying the 27-year veteran responded well to doctors' instructions. He thanked the community for their prayers. And that's your Rush Block on this Monday morning.
Well, there are new concerns with COVID-19 popping up again in the future, and it leaves many questions about immunity and longevity during the seasons. Marcelino Benito connects the dots.
As we are focused on the effects of the coronavirus pandemic right now, many scientists who study viruses are worried about the second wave of COVID-19. So what would that look like? Let's connect the dots. There are a lot of factors that could determine what a second or even a third wave of this coronavirus would look like. One of the biggest questions is immunity. Because this is such a new virus, we don't know right now how immunity will work. For instance, people who contract mumps are immune for life. For some types of the common cold, it only lasts about a year. If there is some immunity with COVID-19, if and when it comes back, the areas already hit hard will likely be spared, so cities on the coast like New York and Los Angeles would not see large outbreaks. According to the Mayo Clinic, you would expect the middle of America to become the new hotspot. The other factor is whether this coronavirus is seasonal, like the flu. If it behaves like influenza, it could slow down during the summer, then re-emerge in the fall. That's what happened with the Spanish flu in 1918, with devastating results in the U.S. Connecting the dots, I'm Marcelino Benito for H-Town Rush.